Joint restoration is a fairly new term that's made its way into the joint replacement and sports medicine field, and it really represents a continuum of many different treatments for treating joint pain. Traditionally, people have been aware of joint replacement, but not everybody needs to have a joint replaced. Some people don't have arthritis that's severe enough for that, and so there's other things that we have available to us in order to treat joint pain. So it really represents a continuum of care. On one end of the spectrum of joint restoration, it can be treating with viscosupplementation, which are kind of artificial joint fluid or joint lubricants, as we'll call them. It can be a cartilage transplant, or it could be a partial knee replacement as compared to a total joint replacement. So depending upon the individual, joint restoration refers to a continuum of care with different modalities in order to treat a person's specific problem. Again, restoration represents a continuum of care, and so restoration is a less invasive approach to patients with joint pain. So the advantages of joint restoration in that approach versus a replacement is someone may be allowed to continue with sport activities, impact activities, which with a traditional partial or total joint replacement, we won't allow someone to do impact activities such as jogging, running, and basketball or those types of sporting activities. I think really anybody is a candidate for joint restoration, and that refers to a continuum of care from least invasive to most invasive. So we always try to at least explore the options of joint restoration before discussing a full replacement with a patient. So we consider usually younger individuals as candidates for joint restoration, but certainly someone that is older, say age 65, may be a candidate for joint restoration, which could be inclusive of viscosupplementation or even a partial replacement. And so the individual is looked at and their activity levels to determine what is the best approach in order to treat their specific joint pain. With joint restoration, the rehabilitation process, depending upon the modality chosen by the doctor, will allow a quicker recovery and will be more rapid return to activities and sports. If someone just has been treated with, let's say, viscosupplementation, there would be no restrictions usually the day following the injections and would be able to return to those full activities. If it is a partial joint replacement, then they may be able to do more activities such as sports that don't involve impact. If it was a resurfacing, for instance, of a traditional hip resurfacing, usually after someone recovers from that, they can resume full impact and sporting activities without the concern of a hip dislocation or wearing out of the prosthesis, which is traditionally feared with traditional joint replacement. Depending upon the modality chosen for joint restoration will determine those long-term restrictions. At the lowest level on the continuum of injections, such as the viscosupplementation, then there would be no long-term restrictions. With the joint replacements partial or complete, then there would be some restrictions with activities, fear of dislocations, concern for wearing out a partial bearing or a joint replacement. And so depending upon the replacement or the restoration process that was chosen would really determine what limitations long-term could be expected. And that's certainly something that would be discussed with the patient and their doctor and based on their individual treatment plan.